Good morning, and thank you for joining us. We're thrilled that you're here with us today for an important conversation around our students' mental health and equity gaps that exist, along with the impact of the pandemic on our diverse student populations. My name is Dr. Leah Jarnigan, and I serve as the Interim System-Wide Director for Student Wellness and Basic Needs Initiatives at the California State University Office of the Chancellor, and it is my honor to welcome you here this morning. Couple of logistics before we get started this morning. Please know that our webinar is being recorded and it will be posted to our CHEBNA Virtual Learning Series website, which will be dropped in the chat for you during this morning's session. I also want to let you know that closed captions are available for you by clicking on the CC button at the bottom of your screen. In addition, we will be providing the opportunity for you to ask questions this morning, and therefore we're using the Q&A feature for that. We will also have the chat feature available for you, but please know that we will not be monitoring that, but rather we offer that to you as an opportunity to offer comment or kudos or emphasize something that has been said on this morning's webinar. With those items now covered, it is my honor to launch our webinar this morning. I am joined by a group of colleagues who each bring their own unique expertise to our, webinar this morning. But before I ask them to introduce themselves, please let me also share with you that the CHEBNA Learning Series includes the topics that you see covered on the screen here before you. These events have taken place this spring term. As during the pandemic, even though we couldn't come together, we wanted to continue to make sure that we were focusing our attention on the progress that is being made, both in California State University, but across our higher education segments in the state of California. And so the items that you see here before you are webinars that have happened this spring, and those are available to you at the website that you see highlighted in red here. This is our CHEBNA Virtual Learning Series website. This is the site where today's webinar will also be posted following the event today. And with that, I am pleased to invite our panel members to join me and to take a moment and introduce themselves to you. Each of these individuals bring very unique expertise on the topic of college student mental health, as well as the impact of the pandemic and ongoing access inequities that exist to the conversation. And so I'm pleased to ask Dr. Carolyn O'Keefe to please introduce herself.
Good morning, everybody. I am Dr. Carolyn O'Keefe. I am a licensed clinical psychologist, and I'm the Director of Counseling and Psychological Services at California State University, San Bernardino. I am happy to be a part of this panel, as I have worked in college mental health for many, many years on several different CSU campuses, as well as UC campuses, and in a private university within the state, and have been in higher education, goodness, for over 25 years. So I'm really looking forward to today.
Thank you so much, Carolyn. We are really grateful to have you here with us today, and know that you'll bring some very important insights. Next, I would like to invite, waiting for the box to come up. Let's see, how about if I just call on someone, maybe Jessica?
Sure. Good morning. I'm not sure if my video is on, but hopefully you can hear my audio. My name is Jessica Petros. I'm a licensed clinical social work by training. Oh, there I am. Hello, everybody. Currently, I'm a senior project manager at John Burton Advocates for Youth. And for those of you that aren't familiar with our organization, we're a statewide advocacy organization for current and former foster youth and homeless youth. And one of our core priority areas is developing strategies to increase post-secondary attainment for youth in the foster care system. And we do this work both statewide through work with the legislature, as well as statewide technical assistance and training. But we also do this work locally, regionally in Los Angeles County, where I am based, where we're also looking at regional systems change strategies to remove barriers to increase post-secondary attainment for foster youth in LA County. This is part of the Foster Youth College Advancement Project of the LA Opportunity Youth Collaborative. And one of the reasons I'm joining this panel today and very excited to be here is that one of our initiatives has been addressing the mental health needs of youth in the foster care system at California's colleges. And one of our projects that we worked on that I'll be happy to share a little bit more about today has been in partnership with the LA County Department of Mental Health and the California Community College's Chancellor's Office to develop some new strategies and best practices to leverage resources from our community-based mental health organizations to be able to bring co-located mental health services to address foster youth students as well as other vulnerable student populations. So I think there'll be some exciting lessons learned to be able to share from that initiative with our partners at our community colleges, as well as some of our other systems as well that can take some of these lessons learned and thinking about these students. So great to be here. Thank you so much.
Thank you so much, Jessica. And for those of you who may not be aware, all of our public higher education institutions have benefited tremendously from the expertise of Jessica and Debbie and others at what we affectionately refer to as JBay. And so they've been incredible partners for us as we have been working on serving the needs of our students with basic needs insecurity. So thank you so much, Jessica, for being here.
Thank you so much.
Yes, Jeannie.
Good morning, everyone. My name is Dr. Jeannie Kim. I use she, her pronouns, and I am the System-Wide Director for Student Mental Health and Wellbeing for the University of California Office of the President. And in my role, I have a wide portfolio ranging from supporting our basic needs initiative efforts across the campuses to ensuring unencumbered access and equity gaps for our students who are accessing health and mental health resources across the system. So I'm excited to join this amazing panel group. I've been in higher ed for over 10 years, and I have been in both the two different systems, the CSU system as well as the University of California system, and excited to participate in the panel to think about system-wide approaches and intersections between collaboration with our statewide partners in these efforts. So thank you for having me today.
Thanks so much, Jeannie. And I will speak as someone from the CSU family. If we were going to lose you, we're happy that you stayed in California and in our Chevna family at the UC. And I'm thrilled to have you as my partner in the system-wide work. Thanks so much. And last, but we know not least, Nathan, may I ask you, please?
Of course. Hi, everyone. Really nice to be here. My name is Dr. Nathan Demers. I'm a clinical psychologist and the Vice President of Clinical Programs and Strategic Partnerships at Grit Digital Health. We are a multidisciplinary team living at the intersection of behavioral health, technology, design, research. And what we do is we design behavioral health tools to help target populations really improve their overall mental health. So most notably, we do that with you at College, which is a mental health and well-being platform that's at 160 campuses across the nation, including 13 of the California state schools. So I'll largely be able to speak to the experience of our partner network and leveraging the shared knowledge of those 160 campuses in our conversation today. Really happy to be here. Oh, I do have two kids running around downstairs. If you hear yelling, that's what's happening. Everything's okay. Just 2 3-year-olds.
Just 2 3-year-olds. There's the quote of the day.
Well put. Oh, and a 5-month-old, just to add to the fun.
There we go. Thank you so much, Nathan. And we truly in the CSU have been the beneficiaries, if you will, of a wonderful partnership between the CSU and you at College. So thank you so much for being here. And so before we get started with our topic this morning, I would like to invite everybody who's on the call to make sure that they are taking care of themselves and doing what they need to do to be well in this particular moment. And I want to share with you that that's what our panelists are going to do as well. We are going to have a more casual, interactive conversation with each other through the content portion of our session today. And we are going to be taking care of ourselves, whether it's 2 3-year-olds or the need to have some additional coffee, whatever it might be, and want to do so not only to enjoy today's experience, but also in the spirit of Mental Health Awareness Month, making sure that we're doing what we need to do to take care of ourselves as well as give to others. So I invite you all to do that as well. And with that, we will go ahead and begin our topic this morning I'm going to ask Nathan, if he will, to set the stage for us around what we know in college student mental health, both here in California, but really from a national perspective, and do so in both a pre-COVID as well as an impact of COVID context. And we'll do that with starting a PowerPoint, and we'll be engaging with Nathan through this time. If you have a question about anything that's mentioned, please feel free to drop that in the Q&A feature. We do have someone who is monitoring those for us. And with that, I'll turn it over to Nathan.
Awesome. Thank you so much, Leah. So before we dive into a little bit of the background, in light of Mental Health Awareness Month and being in the profession we're in, wanted to ask a few questions of you to get to know the audience. So I just dropped a link in the chat. So if you could navigate over there, click that link, that should take you to a screen that will allow you to answer some of these polls. When it asks for your name, you can skip. You can put in your name if you choose. It's confidential. We're not monitoring anything. And we just really want to get to know, first off, how everyone's doing today. So I'm going to stop talking for just a minute and see how we're doing. So this one, you actually just like click right on the emotion that you're feeling right now. Happy, glad to hear it. A lot of happies. Wow. Insecure, I'm sorry, whoever's feeling insecure or worried. If there's anything we can do to help, please know that we are happy to. Overwhelmed, I know I can relate to at the end of the school year and so much going on. Joyful, energetic. Whoever accidentally hit outside the wellness wheel, you're welcome to submit another response too. Don't be shy. I know I've made that mistake before with this.
Maybe that's where they're feeling.
That's true. It's just outside of the box or outside of the wheel. That's a possibility for sure. Awesome. So there's going to be a few more polls. We're going to dive into another one right after this. I'm going to give it just another second. But if you could please leave this tab open on your browser throughout the presentation, we're going to be returning to this a few times, as it's a great way to get feedback from you all and hear your voices as we get going. So I'm going to advance to the next question. And we'd love to know what your role is on campus. And I know this is a little confusing, but instead of using spaces, if you could use a little underscore, because this is going to be a word cloud. And without that, our titles just get broken apart into chaos. Transfer Center Coordinator, here we are. I love word clouds, and with a lot of people, it can be overwhelming, but it's more fun than just looking at a regular list. So thanks for bearing with me, or with us. Thus far, I'm seeing a really nice diversity of folks on campus, which we always love to see. I'm glad someone got a smiley face in the mix too. Good work. Great. Any thoughts from panelists on the group that we have in the audience today?
I'm loving just seeing that basic needs keeps popping up there, big and
Agreed.
bold.
Mm-hmm. Great. All right, I'm going to advance to the next so none of us get a headache by that refreshing too often. All right, and this one, would love to know, just moving into the fall semester, what is the #1 challenge that your campus is facing? This is not a word cloud, so feel free to just type out whatever it is in a couple words. Obviously, try not to write a novel for us. I can very much relate with that one. COVID anxiety, DEI. We'll let this run for just a minute or so, because we'll hopefully get a good handful of responses. And for those responses that maybe don't get up in this time, because there's so many of us now, I can make sure to share this afterwards should people be interested. I think these are all things that I know I can personally relate to, especially hearing from our network. Vaccine mandates, repopulation or reentry. I've heard that a lot of times.
Yes.
Basic needs.
Many moving pieces on the CalFresh front, so I can certainly appreciate the focus on that.
Mm-hmm. And I think another thing that I'm seeing here is a lot of folks have this misperception, or the media is saying like, we're just back this fall, it'll be great. And we very much know, not just in terms of mental health, but basic needs, even just online hybrid learning, that it's not just going back to normal. There are going to be many interesting new norms we have to make. Great. Well, with that, thank you so much for your responses. As I mentioned, please keep this tab open because we will be coming back to this. I'm sorry if your response didn't populate. I think we're just typing too quickly for this to populate, but I love seeing that we are having more and more responses.
I do want to underscore the expectations of our students post-COVID. I think that's a very real reality that we're all going to face when we come back to campuses, and not knowing what those expectations are going to be can certainly raise anxiety.
Absolutely.
Well, and certainly the associated mental health concerns that they're coming back to campus with. Not only the anxiety of COVID and all of that and returning to campus, but that's coming on top of the baseline of what other pre-existing challenges they had that may or may not have been exacerbated by being basically in quarantine for the past 12 or more months.
Yeah.
Yeah, that's a great
we have seen things like increases in domestic violence, intimate partner violence, things like that. So I think we need to be very mindful of what kind of trauma or mental health concerns they're going to be coming back with.
Yes.
Absolutely. Thank you for that. And as I'm presenting these, please, everyone on the panel, please do jump in as you're already doing. Great work. So to kick us off, I just wanted to share some trends related to mental health and well-being. This is pre-pandemic. So we know, unfortunately, over the last decade, again, pre-pandemic, that utilization rates within college counseling centers have really had a difficult time keeping up. On the other side of that coin, we also know that 50% of students who stop out prematurely of their educational journey due to a mental health condition have never accessed support for that condition. So we know that a number of students are unfortunately falling between the safety nets that we're creating. We also know that faculty and staff are being presented with mental health concerns that they just don't feel equipped with how to respond to. Most tragically, we know that suicide has remained the second leading cause of death on college campuses. And quite frankly, this is what catapulted me into this line of work. Going from college counseling, knowing that a number of students who die by suicide never see a behavioral health provider is simply heartbreaking to me. That's what made me really want to get into this upstream line of work. And then we also know that the majority of students were reporting that their mental health was negatively impacting their academic performance in the past 4 weeks. So again, pre-COVID, we're still pre-COVID here. This is a survey from NASPO, which I'm sure many of you are familiar with. In their 2019 report, they did a pretty robust survey of higher ed administrators across all institutional types. And as you can see, mental health concerns were actually rated as the #1 challenge back in 2019. And what this all speaks to is that mental health is something that has been on everyone's radars. And unfortunately, when we say enter COVID, I think we can all agree that that didn't do any favors for our students or our own mental health. This is some data from Active Minds, which many of you may be familiar with. They have about 600, I think, or so. It was 550 a little while ago, but they're growing very quickly. Chapters nationwide. And they surveyed their students, and you can see that, of course, just like us as administrators, mental health and just stress, disappointment, sadness were very much exacerbated in light of COVID. And I'd love to just pause and kick it over to my panelists if they'd like to add anything on this point.
Yeah, I just wanted to add to, as we're thinking about the impact of mental health on students, even pre-COVID, to also encourage our partners to think about some of our most vulnerable students or those that have been in the foster care system, because we know that for those students, research shows us that for foster youth transitioning into adulthood, they actually have a greater likelihood of experiencing physical and mental health problems than their non-foster youth peers. So I think for these students in particular, there's even more complex trauma and factors to consider for the student population, as well as access to care and barriers that they experience as well. So when we look at those outcomes as well, it's only like 11% of our foster youth end up graduating with a 2-year or 4-year degree. So I think we really need to think sometimes creatively and outside of the box to have some unique strategies to also address their unique needs for that student population as well.
Yeah, to add on to what Jessica was saying, we also need to consider the impact that COVID, there's a lot of inequity in the impact that COVID has had in our diverse communities. So, our students that are coming from, minority communities that may have less advantages, are coming in with COVID having had a much greater impact perhaps on them and their community and their families than on more advantaged students. So I think that disparity in health then becomes a disparity in mental health as well.
Mm-hmm.
Yeah,
Absolutely. And we intentionally, I want to make sure that our audience knows we are intentionally focusing this webinar on our students from our diverse communities. And that will be a focus of each one of the questions that we'll have as we go on in this conversation, because we do acknowledge who our students are and want to make sure that we are meeting their needs in that way.
Mhm.
I was just going to add, I think from a larger perspective, we're at this point in time where there's a shift in the students who are attending one of our universities, whether it be the CSU, California Community Colleges, transferring into CSU or UC, right? And we're seeing a demographic shift as well in representation of many students who are able to attend one of our universities. And I think as we see this shift happening, it really changes the way that we are approaching these equity gaps and ensuring that students have access to care and services and supports, and really shifting our kind of social norms of what we think the typical college student is now. And so being able to identify those factors that can help us ensure that our students have access to care is really important.
Thank you all. Those are great points and actually transition us really well into these next couple of slides. So just zooming out, these are national behavioral health trends in light of COVID. And I just found this fascinating. This was a report that McKinsey and Company did. And you can see initially, if you look at the bottom left there was a very significant decrease in overall individuals seeking therapeutic services. This is a big bucket. And fascinatingly, you can look at regionally, there were some significant differences. I'm here in Denver. I've been working on trying to figure out what that 74% increase is due to. Don't quite know. But then we look at other places and just looking at, not to call you all out, San Francisco and Los Angeles, where we saw some very significant decreases. And I think this data starts to show that there were some very significant impacts across the board. So this is breaking out different types of mental health services. Not surprisingly, right off the bat, we saw telehealth utilization go way up, but we also see some very interesting trends where we saw assessment and testing go down. And while many people might think, oh, it's just assessment and testing, that means maybe students aren't getting accommodations in the classroom, learning disability assessments, differential diagnoses. Those are very important things that have huge impacts on students' educational journeys, both K-12 and in higher education. But furthermore, when we look at all behavioral health services, we saw about a 6% increase in overall services from the beginning of the pandemic. This is through October, and I can tell you that these trends line largely continued. But what we know is that distress went up much more than 60%. Mm-hmm. In looking at the Active Minds data, we know that 80% of students were reporting significant symptoms of either loneliness, anxiety, depression. And again, I'm just scratching the tip of the iceberg here. But we know there's a lot of unmet need. I want to do a quick trivia question. I hope you all kept that poll nearby. So in the fall of 2020, what percentage of students said that their mental health negatively impacted their academic performance in the last 4 weeks? We'll see how quick folks have that access to it. Great, perfect. Glad we're seeing some come in already. I love watching these bars populate for some reason. I don't know why. I find it fascinating. All right, a nice diversity of answers. Great. I'm sorry if you didn't get to put your answer in. I'm going to keep us moving because we have a very intelligent audience here. The correct answer is indeed 83%. And as soon as my screen decides to advance, I don't know what I have to do. There we are. Perfect. So as you can see, 83% of students said their mental health was negatively impacting their academic performance. So we know the very best of counseling centers at full capacity, when they're humming, can serve 15 to maybe 20% of a campus body. That begs the question for me of what about that other 60% who aren't having those needs met? And we also see that from fall 2020 to spring 2020 to fall 2020, we saw an overall 23% reduction in overall services. And we know that unfortunately, students from historically marginalized communities composed a large percentage of that significant decrease. So we know that we really have to work on targeting and helping support those students who are coming from backgrounds that are disadvantaged in some way, shape, or form. And two other quick stats, and I want to open it up to the rest of the panel to add. But what we did here, this is from the AUCCCD survey, which is the Association of University College Counseling Center Directors, a very difficult acronym for me for some reason. But we know that a lot of campuses did a lot more work triaging clients, for example, referring out a little bit more quickly, because telehealth obviously is much more approachable, and then you cut across with state lines, students being all over the country. It just didn't make sense for a lot of campuses to provide that. But the thing that was very alarming to myself is we see that a lot of campuses, unfortunately, in light of COVID, had to decrease the overall amount of outreach activities which they're engaging in, which that's the way that we historically reach our most vulnerable populations, which are those with high needs that, for whatever systemic or institutional barriers exist, are not reaching out for our traditional networks of care. And I want to open it up and see if my panelists have anything to add on any of that.
Yeah, I will add to the fact that this to me is an alarming trend, and I want to also add that sometimes this trend is not necessarily being driven by counseling center directors, but sometimes there's pressure from upper administration to do more kind of those traditional services and less outreach, so that you have more time to see people one-on-one with those traditional services. And as Nathan just stated, this is the way in which we provide an entree for a lot of students that are from our ethnically diverse, racially diverse populations to be able to have kind of a taste of mental health services, and perhaps kind of see us as human and not vampires or gargoyles, and not be so afraid to then come to the counseling center or reach out for more of those kinds of traditional services. I know on my campus, we experienced the opposite. My campus at Cal State San Bernardino is predominantly Latinx population. And so we know that we need to be creative in how we offer services to folks. And throughout COVID, we saw a significant increase in our outreach activities, which were all virtual, as opposed to our one-on-one services. And so we know that when we have those interactions and have those multiple points of contacts with folks, they're going to become more and more comfortable with the idea of talking about mental health, and then perhaps reaching out and getting additional support if needed. For some people, these activities, they serve the need. They get some skills, they manage their challenges differently, and they don't need something further. But others, oh, hey, maybe I should go see somebody to get additional skills.
Mm-hmm.
Yeah, and I just want to call out, our partners in higher ed that help reduce that stigma and ensure that there's access to care in whatever avenue that feels most comfortable for students. So oftentimes it can be health and wellness practitioners that are doing proactive outreach. It can be our basic needs centers who are also supporting students who are experiencing food insecurity, but may also need additional support and a referral to case managers all the way up to to mental health providers. And so thinking about how we collectively provide support across our campuses is so key in ensuring that our students have access.
Mm-hmm. Great points. Thank you, everyone. And just to speak to some of the underlying factors leading to why some counseling centers had to cut back in those ways. We know that many, unfortunately, were short-staffed in terms of FTE being decreased in light of the pandemic and budgets. We also know that a lot of health promotion folks were tasked with additional responsibilities. For example, many of our campuses, health promotion folks were actually running testing clinics. And of course, it makes it very difficult to be doing outreach when you're doing nose swabs all day and setting up the logistics there. So there's a lot of things that were very challenging with increasing responsibilities in less time that unfortunately can unintentionally lead outreach to just being kind of swept under the rug for a time being. But we also know with folks being tasked with so many things related to COVID, there's also been a lot of feelings of burnout in terms of faculty and staff, and specifically in helpers on campus in terms of counseling centers, basic needs, other folks that provide those direct student services. And we also know there's been some radical shifts in the way that students are engaging in help-seeking behaviors. A lot of students as digital natives already had the tendency to go online. Now we've really embedded that. And our campuses really have to find ways to make sure that we are meeting students there so that we're not unintentionally missing them. Because in distance or hybrid environments, if you're not laying eyes on a student, it can be very difficult to see if and when a student might be experiencing some distress. Anything to add on these notes?
Yeah, I just want to share that I think that the technology piece of distance learning has really been a mixed bag for us. You know, I do think that it comes with challenges, but I also want to say that there are a lot of positives that also came with it that are going to help us all shift into hopefully more hybrid types of services that we're offering, because we know that there are students from lower income homes that maybe distance learning is a better option for them because, or distance services, because maybe they can catch that workshop or meet with a health educator or a counselor in their car during their break at work. Whereas before you had to be physically on campus, or folks that may have family responsibilities. Or even the fact that, oh, hey, I don't have to walk into the counseling center where other people can see me, you know, reduces some of the stigma as well. So I think we have to look at this as you know, kind of both a curse and a blessing that COVID brought to us. So, you know, we'll keep learning.
Agreed. And that's a great point. I'm just going to keep us moving forward because we have some slides about the positives that came of it in just a second. But another thing that we found, unfortunately, is that this is an article from Inside Higher Ed that we know students' needs have largely gone up, and a lot of students are choosing not to seek services through their institutions, which means they're either going to their familial networks, home networks, you know, community health centers or whatever it might be, or unfortunately not getting care, which is, I think, the scenario that we are all most concerned with. So it really speaks to the time that we're gonna really want to get going on that. I do want to ask this question really quickly. I hope people still have that poll. So in light of hybrid distance learning, has your campus implemented digital or mental health, well-being interventions? I'm not surprised that we will probably get an overwhelmingly yes. And I'm not sure, totally cool as well. Thank you for responding, everyone. Keep that link handy. We're going to come back. But we also presented at NASPA National. We had 141 institutions attend our session, and we got an overwhelming yes, very similar actually in proportion to what we just found here. And when we talk to individuals about that, what we've heard is that these things happen so quickly, it felt very sort of fragmented for students. There were some well-being initiatives in the counseling center website, some in basic needs, but then career advising was trying to do something because they touched so many students, and students simply didn't know where to go for what. Which when we know when anyone's in distress, if you create some barriers wayfinding, that makes it very, very difficult to follow through, which really speaks to the need of us as higher ed administrators finding ways to streamline that for students. But I do just very quickly, as we were alluded to a few minutes ago, talking about some of the positives that we have seen come out of this. So first off, we've seen it's over a 6,000% increase in overall telehealth provision, which is not surprising. But we also know that many campuses, and especially within our network, we've heard that telehealth has broken down many barriers for certain demographics of students. So I know my partner works at a counseling center, and they're actually going to keep 1 day of telehealth for each of their providers to be able to meet students who can't make it due to childcare or whatever it might be, which in my opinion is a huge win. We also have many more institutions transitioning to more of a formal stepped care model. What that means, as we were talking about before, is offering everything from self-help, online confidential services, all the way up to psychoeducation, maybe online CBT modules, to one-on-one therapy. We know that individuals' comfort levels, students' comfort levels, might lie anywhere on that continuum of where they want to enter getting any sort of treatment. And then lastly, we have seen some great uptick in a lot of those prevention-based services, psychoeducation. We've seen over 150% increase in our overall traffic, which has been great. And in digging down, we're able to look at some demographics. We've actually seen that we have had much higher representations of historically marginalized communities than are represented on many of our campuses, which speaks to the very important piece that we've all sort of alluded to of making sure that we are connecting with students on their terms and not just relying on our traditional supports. So we'd love to
I just want to,
please.
I'd like to jump in about the stepped care model. I think it's really important for us to keep in mind that the stepped care model also helps us to apply some positive psychology and really help students recognize what strengths they're bringing, and not saying, oh, well, just because you have an issue, you need one-on-one psychotherapy. A stepped care model helps show, hey, yeah, you have this issue, but let's normalize this issue. A lot of folks have this issue. Let's put you in a work group or a workshop or a group or something else. And I think it really plays upon recognizing that our students have strengths. So we want to capitalize on those strengths and help them feel like, oh, hey, I'm bringing something to the table.
It's a great point. And similarly, the most appropriate referral is not always counseling. A lot of times, if I'm a student and I'm struggling with basic needs, but a faculty member just sees a student crying, they might just say, go to counseling. And that is not always the most appropriate referral, which leads to a lot of the bottlenecks that we see in our counseling center. So addressing well-being and holistic well-being specifically is what can help connect students to the right doors. And as these come in, I just wanted to ask about other positive outcomes that we've seen on our campuses in the past year, but I want to welcome any other comments from my colleagues as we have these coming in.
I'd like to share, I think an important aspect of this is I know that my campus, I can't speak to other campuses, did a phenomenal job in making sure that our students had the technology that they needed to be successful in a virtual environment. So as long as upper administration continues to provide resources to students, particularly students that don't have access to these things, not everybody has their own laptop. Maybe they share with a sibling. Not everybody has Wi-Fi in their home. So it's very important for us to keep in mind that these things are all wonderful, and we want to make sure that everyone has equal access to them.
That's an excellent point, Carolyn, and one that we're going to discuss more here in just a moment. The pivoting that our campuses have done on pretty short notice in the spring of 2020 to where we find today services that are being provided that traditionally have been face-to-face only. That pivoting is one that I think calls upon us to continue to ask ourselves how we can continue those kinds of access points as we move back into some repopulation space.
Thank you all for reflecting on some of the positives. I feel like we spend so much time talking about what hasn't gone right. It's nice to find these positives and also lean into them and grow them as we enter the fall 21-22 semester or academic year. So thank you. Oh, I don't know what I did there, but I clearly hit the wrong button. So just a couple of quick thoughts in summing up all that data that we shared, and then I'll be turning it over to my panelists. But we know that students' needs are now more diverse than ever. Students have been impacted in so many unique and disproportionate ways, depending on the home communities that they went to. And that's very important to remember, that a one-size-fits-all approach is not going to be sufficient moving into this fall semester. And another positive is that mental health has been sort of the issue of the last while. Folks are also talking about mental health in a way that they have not historically. For example, a lot of our campuses, when it comes to Blackboard or Canvas, whatever your LMS system is, a lot of campuses historically have said, if it doesn't have to do with academics, we're not putting it in this platform. Where there's been a large change in saying, you know what, mental health is impacting the academic experience. And going back to that normalization, when we can convey that tending to your mental health and well-being is just as important as making sure you turn in your assignment on time, we can make some great progress in raising awareness in getting students who traditionally don't seek out formalized care in that way. And then lastly, this really relates to the first point, in that students' needs are diverse. And one risk I think we have is if we do what we think students need, we might miss the mark. We now more than ever have to work with students, alongside students, to have them guide us in whatever interventions we're making, whether that has to do with basic needs, academics, online learning, anything. We can't be calling the shots because we were impacted in very different ways than students. So with that, I want to turn it over to my colleagues for anything else they want to add and go from there.
Thank you so much, Nathan. I think I'm going to take this as a great jumping off point to lead us into our first all panel question. I want to make sure that we're at that point and we're ready for that. Yes? Okay, great. And so if you want to go ahead and turn the PowerPoint off, and that way folks can see all of your lovely faces. Wonderful. Thank you so much. Okay. Well, Nathan, really appreciate you setting the stage for us and providing a broad-based understanding of our students and their experiences, both pre and during COVID. I want to turn now to ask the panel to reflect a little bit deeper about the construct of access. There have been many points brought up in the first part of our presentation this morning that speak to access, including some strategies that can, if you will, level the playing field for all of our students to be able to seek out and to receive the kinds of supports and assistance that they need in order to remain engaged in the academy, to pursue their degree and to go on to their future endeavors. And so why don't we start from a place of touching upon a little bit deeper what we know about what impacts access to supports for students, and particularly how might there be disparate impacts, and we know there are, from our diverse student communities, whether they be former foster youth, they be LGBTQIA+ students, there are students from historically underserved backgrounds, low income parents, etc. What do we know about that, and what can we do in order to increase access for all of our students to receive that support? So let me start by asking if there's someone who would like to launch us with that. Jessica, I think I saw, yes.
I'll start us off.
Great.
You know, as I had shared, we had done some work specifically addressing the needs of our current and former foster youth students at our community college systems. And I think there are definitely some unique considerations when we're thinking about access to care for foster youth students. Many of them have experienced the mental health services as children. A lot of times those are negative experiences. Sometimes they can even be traumatic, often forced upon them. I think also for many of them who have had so much trauma with moving from multiple placements to multiple homes, to multiple schools, that they are going to be less likely to engage with a new provider, a new person, and that takes time to build that trust, to build that relationship. I think especially when we're recognizing that so many youth in the foster care system additionally are disproportionately Black and Latinx, and so there's complex identities and experiences for them accessing care throughout their lives. And so While we know that mental health is a need for many of these students due to the trauma that they've experienced, I think there needs to be some unique strategies to get them connected to services. And what's unique also about this population is that many of them do have Medi-Cal until the age of 26. But what we realized, particularly for our community college students, is that, a lot of the services at our community colleges are short-term, often impacted, wait lists, and 6 sessions, is not often enough to really address some of the unmet mental health needs that the students were experiencing. And so one of the things that we did is leverage our community partners, leverage existing mental health services, and worked with our community college systems to develop really strengthened relationships with their local mental health providers to bring on-campus supports. This is pre-COVID, right? On-campus supports to the campus. So it was easy for students to access those services, because just giving someone a name or a referral just really wasn't enough. There needed to be opportunities, organic opportunities, maybe within their existing basic needs centers or foster youth support programs, to get to know the provider, get to know the therapist, build that relationship, maybe through less intrusive means or less stigmatizing opportunities, maybe just general outreach events, integrating these services into existing programming and workshops that created just a natural opportunity for a student to feel comfortable and build that trust and build that rapport. And through developing these essentially MOUs with the providers, it really lended to a strengthened referral process, so that there was quick response times for students to get connected to care within 24 hours. And the folks who designed these referral systems were able to have a feedback loop to know that the referral was successful. Because what we didn't want is students falling through the cracks and simply just getting a phone number to call, but that there was coordinated care to make sure that they were linked to services, and when possible, bringing the services on campus so it was easy for the students to access. But of course, knowing that not all students like that, right? Not all students want to walk into the counseling center. So also having the flexibility with these community mental health providers that they can meet the student where they're at their home, at a coffee shop, at a park. And I think because those relationships and partnerships were established, it withstood the test of COVID. And because those relationships were in place, services continued for these students, even when things transitioned to telehealth, because there's that strong communication between the college campus and the mental health provider. So I'll put into the chat too, there was about 10 community colleges in LA County that implemented these best practices, and through the chancellor's office, these best practices were put into a toolkit. So there's like sample MOUs, sample assessments, sample tools that a community college could use to address not just foster youth, but other vulnerable student populations, to think about how to creatively bring additional services to address that access to care piece. Because many of them also set this up for our homeless students, our CalWorks students, our dreamers, other targeted populations at the campus that really would benefit from these real wraparound services. So I'll put that in there if anyone's interested. And I'll just note too, I was so excited to see that there were so many basic needs centers when you were saying what your role was. Because I think that's another great opportunity to weave in mental health services as an access point, making it easier for students to not have to go to multiple locations on a college campus, but meeting them where they're at, if they're needing food, if they're needing housing, to have that as a really great entry point to get them connected to those wraparound mental health services as well. So I think that's another opportunity to address students' needs.
Yes, absolutely. Jessica, you made so many important points in your comments that I can think of 7 different directions to go. But one thing I really want to underscore is that mental health and supporting the mental health of our students is not solely the responsibility of our counseling centers. It is the campus's responsibility to provide supports for students, and our counseling centers have a very unique and critical role to play in that. And I think that's what you're speaking to with the concept of weaving supports throughout multiple touch points on campus. I want to throw it over to Carolyn for a quick moment and say, Carolyn, I know your campus has a really well-established relationship with your county mental health department. I think would be an opportunity for folks to hear about that.
Yeah, so prior to COVID, we had embedded on our campus a San Bernardino County social worker, and what that provided for us. So she participated in our care team, our campus care team, which is a team that's brought together to provide support to students that are having all kinds of challenges. And she also worked closely with our counseling center. And she's able to do those connections that Jessica's talking about. She's aware of county resources. She's able to help connect students to the county resources. She's able to help students enroll in Medi-Cal if they don't already have that access. We have folks on campus that help with CalFresh through our basic needs program. But this kind of communication and partnership with our county resources has been invaluable to us. You know, as we shifted into COVID, we have an incredible relationship with our San Bernardino County Department of Public Health. And myself and our healthcare providers meet with them twice a month to talk about what's going on with the pandemic and how to serve our clients and our patients in our health center and our students in general, to make sure that resources from the community are being channeled to our students who may not be aware of them or may not know how to access them. I think, you know, to go back to your original question, I think some of the things that we need to keep in mind is that there's a lot of disparity in not only access to technology, but, you know, when we talk about, oh, okay, we're gonna, you know, depopulate the campus. Well, for some people, there is a home to go to. For other people, there isn't a home to go to. For some people, there's a home to go to, but it's a small home with multi-generational family members sharing a small space. And then increased responsibility when now I'm back at home. So there's the expectation that I participate in caring for my grandmother, caring for my younger siblings, you know, whereas when they're not at home, they get a little bit of a buffer from that. So I think it's important for us to be mindful of the disparities in just in life that folks have, and how we as university campuses can help attend to that. Like, for example, if you're trying to, as much as possible, depopulate your housing, you know, we need to think about our former foster youth that don't have a home to go to, in addition to our international students who may not be able to go home, and things like that, and to continue to provide housing opportunities for them, whether those be on campus or in the community, because that's another place where those partnerships are so very, very important. And I'm going to argue that, you know, oftentimes when we talk about basic needs, we're really talking about housing and food insecurity. But I think a really important part of that conversation is health and wellness. How can health and wellness not also be a basic need? Whereas so often it's kind of seen, you know, student affairs people are familiar with Maslow's hierarchy, you know, and for a long time, like, counseling was up at the top. You know, it's like, oh, I'm going to self-actualize and go to counseling, but really it needs to move down and be in that lower building block of that pyramid, along with physical health, because we know that the disparities exist in our communities around access to these things. We also need to tap into the strengths and resiliencies of our communities. Earlier in the presentation, Nathan said something about, you know, some people turn to their, you know, innate support systems, their families, their communities. Well, that's a good thing. And when people have those things, we need to encourage them to engage those types of supports and those types of tools. But you know, I'm clearly very passionate about this. I'm biased because I'm a psychologist, but I really think that when we're looking at disparities, we can never forget that traditionally underrepresented minority groups have had less access to mental health for sure, and sometimes good health care. And so, undocumented folks, right? We want to make sure that there are avenues for these students to get the services that they need. And if we can't provide that on campus, then we need to have these partnerships to be able to help them get these services in the community. And whether that's a partnership with Jessica's organization, a partnership with your local Department of Behavioral Health, County Behavioral Health, and Public Health, whatever that may be, de-siloing and building these partnerships is crucial.
It is, and you have raised excellent points that I think speak directly to what I'm going to ask Jeannie to share with us. And so let me cue a couple of ideas that you've brought up, Carolyn, that I think are really germane to Jeannie's content she's going to share with us. You're talking about the need for our institutions to expand traditional concepts of what basic needs include. And I know the UC has been doing some very intentional work on seeking some consensus and true buy-in from campuses, as well as many external partners, in redefining basic needs in the UC system. You also talked about the importance of partnerships and how we must think beyond and move beyond the traditional confines of our college campuses. And I know the partnerships is a piece that Jeannie is going to share with us as well. And quite importantly, you spoke about the disparities among many of our students' communities and how oftentimes this has really nothing to do with our students themselves and their identities, other than how those identities have been disproportionately prohibited access to care and access to quality care, and how those then become social determinants of our students' health as they move into our campus communities. And I know Jeannie is going to share with us some thoughts about how we can look to disrupt those determinants. So Jeannie, let me turn it over to you.
Sure. So I think at this point, you're queuing me up to share my screen and this brief overview of how we're working collaboratively as statewide partners. So hopefully you'll see that. If I could get a thumbs up from someone. Thanks, Nathan. So as Leah was mentioning, we individually as different segments have been championing a lot of our work across basic needs to advance this expanded definition to include just more than just food and housing. Speaking to what Carolyn was saying, we really have to actualize how we can provide services and supports for our students and unencumbered access to those services collaborativly. And what better way to do that than to do it collaboratively across the segments, as all of the students that we serve are impacted by what we're talking about. So some of the things that I'll share in this brief presentation is thinking about statewide collaboration and partners, right? So I think as we've kind of framed this work, we need to think about the whole campus and the whole student and the systems that are impacting how our students navigate those services and resources. And when we think about health equity, we're thinking about the ability for everyone to have a fair and just opportunity to thrive and be well by removing those systemic barriers as described by the social determinants of health that we've kind of talked about, right? And for those who don't know, the social determinants of health, thinking about poverty, discrimination, access to quality education, safe supportive housing, safe environments, and access to health care, and health being the broadest of physical and mental health, right? And thinking about how we have an opportunity as higher education segments to also disrupt that in and of itself, right? So having access to quality education and higher education actually helps actualize and support students in advancing in their careers, disrupting social determinants by ensuring that they're able to graduate and we're able to retain them and support them to their graduation, right? So as our students are navigating some of the comments that my colleagues have made about collaboration, incorporating technology, one of the other key areas that we haven't really quite touched on is the impact that our faculty have on our students, right? And one of the things that I've recently heard, especially during COVID within the pandemic, is our students' kind of portal to what normal was or is has been the virtual classroom, right? They're not navigating campus resources like they would normally. They're not going, walking by the health center. They're not going to recreation programs. And absolutely our faculty members have been a key gatekeeper in connecting our students to services and resources, and just, monitoring how our students have experienced the pandemic in this virtual environment. So one of the things that we have been in the UC doing is advocating for this opportunity for health equity and this larger discussion of how we can come to the table to also subvert some of those norms and contribute to the gaps in health equity. So one of the things that we know that's happening, at the statewide level are opportunities to collaborate intentionally. And I have up here on the screen, Recovery with Equity, this roadmap for higher education after the pandemic, right? And these key objectives that we've been working closely with at the governor's office to think about how we're supporting our students across the state. And expanding this conceptualization that all Californians from kindergarten through 12th grade, all the way through higher education, how are we ensuring the seamless process for our students to have unencumbered access to care and support, right? And if we're thinking about quality education and access to education for our students, how does that kind of incorporate this seamless prevention, early intervention strategy, where we're providing that proactive support and that navigational capital for our students and cultural capital for our students to normalize, that we all have mental health, right? And that we all have this opportunity to take advantage of taking care of ourselves, both physically as well as in our mental well-being. And so we have these key opportunities that have been kind of outlined within the California May revision to think about K through 14 education, California for All Kids plan, transforming children and youth behavioral health. There's a key opportunity for us to collaborate in thinking about how we can transform our behavioral health crisis within the state of California, and then increasing college affordability and ensuring access. So one of the examples that I just want to put out there from the University of California is we have, this 2025 goal of advancing and elevating equity for students' basic needs, mental health and well-being by providing resources, advocating for policy, and implementing promising practices. There's a lot of P's in that. So as we, conceptualize how we do that within the system, one of the most important things that we have to do, and I think Nathan had touched on this, was stakeholder input, right? We need to consult our students. We need to consult the key experts and subject matter experts, both internally, externally, and really rally together to think about how we're going to rebuild this or build this into an innovation that really helps support the efforts that we're really trying to promote. And then from there, ensuring that we're using data that's available to us, right? How do we leverage the great data that Nathan was sharing with us and ensure that we're tailoring prevention and early intervention strategies that really meet our students' needs? And then, as a system across CHEDNA and our higher education partners, really identifying what those promising practices are, right? And, providing research, input, evidence-based strategies, and sharing with the rest of our higher ed partners what's been working well for our students, especially given the policy landscape and the ongoing funding that we've already received for basic needs within the state of California, to really, share those best practices. And then scaling and sharing those best practices with other colleges and universities, so that they can also implement those same promising practices. And then lastly, obviously thinking about how these are sustainable solutions, right? So we're investing oftentimes with one-time dollars, sometimes with ongoing dollars, but are we developing and designing and implementing sustainable solutions with these guided pathways to care? And I think Carolyn really hit the nail on the head when we're thinking about stepped care, right? So stepped care in the broadest sense, and thinking about, services for resilience, as well as well-being and social emotional well-being for our students, all the way to treatment and crisis intervention for our students. Every single person and stakeholder that is a part of the behavioral health continuum is absolutely critical to the success of our students' academic achievements, right? We need everybody at the table. We need our counseling folks. We need our prevention specialists. We need our health promotion folks. We need our basic needs advocates who are there to ensure that continuity in navigating all the, all the different systems that exist on a campus for our students. And then within the UC, thinking about how by 2030, we're realizing these goals of advancing the California dream and the economic impact that really has, right? So, thinking about this combined across the California community colleges, the California State University system, and the University of California system, what does that mean for our economic mobility for the state of California? That we're increasing these graduates, right? And increasing the workforce and increasing a diverse workforce to meet the diverse needs of our students. And thinking about, from a equity gap perspective, increasing the overall graduation rate for those students who are in our most underrepresented student groups. So thinking about higher ed as a statewide partner, we're thinking about key strategies where higher ed can actually play a huge role. And there are some key factors that we've identified where we can be a huge stakeholder in supporting, that economic vitality that we just talked about. So as higher ed statewide partners, we can provide actually an opportunity for workforce development, as I mentioned previously. And then thinking creatively and innovatively about what Nathan was talking about in this digital care navigation. Our students need options, and we need to be able to meet our students' needs in this digital world, where oftentimes we're no longer actually going on a website to access Facebook or any other type of technologies. Everything has to be on your phone, right? And we have to reduce the number of clicks in order to engage students to keep them engaged, right? I mean, for me personally as a mom, if there are too many steps in a process for me to even complete one task, I'm like, oh no, I can't do it. I need to go attend to my little one, right? And then you forget about taking care of yourself or the needs that you're trying to achieve or get when you're working through that digital care support. And then lastly, thinking about seamless behavioral health support, right? So I mentioned this previously, thinking about the whole behavioral health continuum of care. And, oftentimes students who have Medi-Cal, who have Kaiser, who have another type of health insurance, 9 months out of the year, they may be in a different location and can't access those county-based services or supports, right? And so how do we ensure unencumbered access to all the various services and supports that we can wrap around for them and make it easier for them to connect to those services? And so I'll close with this, framework of thinking about how health equity, social justice, and financial stability are really the key factors in ensuring graduation and student success. Because if we didn't have all of these pillars working collaboratively together as advocacy units, then we won't really be able to address a lot of the gaps that we're seeing and the equity gaps that we're seeing for our students. So I think that's the last slide. I'll stop sharing for a moment and entertain questions.
Thank you so much, Jeannie. Any initial reactions from the panel to anything that Jeannie has raised? And if not, I want to take us into a direction. Go ahead, Carolyn.
I'm going to sound like a little bit like a broken record, but again, I think that Jeannie hit on this. Number one, it's not just the healthcare and the mental health providers on your campuses that are responsible for this. Yep. Everyone is responsible for this. And honestly, we have a responsibility in our counseling centers and our partners to help educate other people how they can be responsible. And borrowing from our public health partners, this idea of primary prevention, secondary prevention, right? So, think Kaiser. You may have good or bad feelings about Kaiser, but their Thrive campaign, right? They want to focus a lot on people being well, rather than okay, we're going to catch you when everything's falling apart. It's like shifting the focus on, let's put a lot of resource and energy into helping keep people well, so that we can focus on the folks that in spite of all that still need those more intense services. But that takes a village to keep people well.
Mhm.
And that's our campus, our community, our larger university systems. And what I love here is the representation that we have across all of higher ed and community and partners, because that's what it takes.
Thank you so much. I'd like to pick up on that notion of continuum of care. And Nathan actually addressed this in answering one of the participants' questions as well. In what ways do you think we do a good job at leveraging the strengths that our diverse student populations bring with them into the academy as we're looking at continuum of care strategies? In what ways are we leveraging our student strengths? What are those strengths? And how can we do that even more so moving forward? Nathan, do you want to start with that?
Sure, I'm happy to start. So there, the first thing I want to speak from our network's perspective, again, those 160 campuses, is that it's fascinating when we look at the data of well-being utilization of our tool within campuses. It's actually very different on each campus, which is not surprising when we take a step back. But the experience of a student who is who self-endorsed being from, let's say, Alaska or Native American populations, that subgroup might be very different at one campus to the other, which obviously is a representation of how that campus is offering supports to those individuals. And of course, that goes all the way from recruitment to what happens when students are on campus and everything in between. So that's a really fascinating piece that we have to think about. But just to lean into student strengths as well as how we can harness them, I think historically, I'm going to be completely honest, I think we've done an okay job. Again, I'm speaking nationally as higher education. I think where we can really lean in, I'm sure everyone's familiar with the concept of human-centered design. It's the idea of how do we include our end users in every aspect of design? Not only design, but are we asking the right research questions when we start out these processes? And I think we really have to go out of our way much further than we have historically to get the perspectives of students from historically marginalized communities, because that's how we're going to tap into these strengths. That's how we're going to learn from them and be able to replicate them and scale them across our student bodies. But if we're not asking and we're not engaging, I think we're risking missing them, which is somewhat what we've done historically.
Great, thank you. Anyone else that would like to pick up on that question? How about any experience that anyone on the panel has in involving students in developing strategies and resources and outreach for students?
Yeah, I know in the work that we did with our community college partners and thinking about addressing the needs of their vulnerable student populations, many of the campuses spoke to their students first to see what the need was, to see, what types of services were they interested in? Did they want therapy? Did they want groups? What was their schedule like? What days of the week? What worked for them? And then using that to build upon the strategies to meet them where they were at. And so, I definitely recommend whenever possible, reaching out to students first to hear from them so that you can be responsive to the needs.
Yeah, absolutely.
Building upon that, one of the most successful health promotion campaigns that I've seen any of our campuses do was actually just a happiness campaign. And they spoke with their students and they said, what's top of mind? What would make you tend to this? And they got these amazing images of like a grizzly bear holding a flower. And things that people are drawn towards. And I have seen so many stickers, posters, patches all over campus because that's something that people want to go towards. And that came from a student idea. And it goes back to what Carolyn was saying of how can we help people thrive? Similarly to what we're doing, we didn't want to make a bummer of a mental health fitness center. We wanted to make a tool that you can go to for anything you need related to your college experience. And that's actually how, when we actually survey our students from historically marginalized communities, more often than not, they're coming in for academic support initially, or figuring out how to cope with a challenging roommate situation. And then they get to the mental health information. But it's a big ask to ask folks just to walk into this mental health door, especially if you're coming from a culture where that's highly, highly stigmatized.
Mhm.
Yeah, and I think utilizing peer-to-peer support and peer networks can be really powerful as well, and also highlights the strengths of the students that we serve, and they can learn from each other and from their peers about the strengths and the skills necessary to navigate some of the challenges ahead.
One of the things that we've done on my campus is when I came on board, I started working with my staff, and what we have now is we have counselors who are kind of formal liaisons to certain populations. So I have a counselor that's a liaison to the vet center, our student veterans, to our Black and African American Student Staff Association, to our undocumented students, to our disability services, right? So we have a counselor that regularly engages with those students. And so you start to build a trust relationship. And so it's not, pardon me, but the man coming in and saying, oh, here, take our survey or whatever. It's somebody that they trust that's asking them, what do you need? And they know this is somebody that really cares about what I need. And this is somebody that maybe I even see myself reflected in this person. And so we have found that to be exceedingly helpful in reaching out to those particular populations. I can say that since we started having two of our counselors are liaisons to the Black Faculty and Student Staff Association, we have seen an increase in those students seeking services in our counseling center. We've found ways to outreach to our undocumented students and their families to destigmatize, so they don't have parents that are saying, no, don't do that, that's not safe. So I think that that's very important to find a way to be an insider.
Absolutely. So I'm acknowledging that we have just under 10 minutes remaining with our time this morning, and we have some terrific expertise on the call in all of you who are in the audience this morning. And so I would like to invite you, if you have a question, to please raise your hand. We would love to unmute you, give you a live mic, and give you an opportunity to ask a question. And I see that we do have Jen Sturdivant. Let's go ahead and unmic her or give her a live mic, and we will.
All right. Hello, everyone. Can you hear me?
Yes, we can, Jen.
All right. Hi, Jen Sturdivant here, care manager from Stanislaus State. Just want to say a quick thank you for this wonderful learning opportunity today. As you were all talking about incorporating student voices, I was interested in seeing if any of you, the panelists, had a suggestion on a template or an analysis plan that you've used to incorporate student voices and propose change to existing programs to other folks on campus, upper management, administration. So if you had any tips or tricks, we have some really rich data we collected this year from student voices, and we're really interested in making some recommendations for our programming moving forward. So any tips or tricks around that would be great.
I'm happy to jump in, but I would love, obviously, folks from campuses to speak to it. Jen, it's a great question. I think what's challenging about human-centered design is that every question and problem is so vastly different. A templated approach might not work perfectly. That being said, we've gotten direct feedback from students around, what sort of digital health intervention would you want on campus? Compile that data and basically just present, here's the challenge. Mental health, students aren't using it. Our counseling center is overwhelmed. Here's what students are saying in some actual quotes and data that supports that argument. Some campuses have actually gone to student government and had them advocate in front of higher level administration. I know stories, in my opinion, are what have really had the biggest impact amongst administrators who might not be providing direct services for students. But again, it depends is my answer. I'd be happy to be a sounding board and talk through it.
Yeah, and I would just add, I think one of the things that is really relevant when we're thinking about our responsibility for the funds that we receive from, our statewide partners for basic needs. One of the things that we've adopted in the UC system is ensuring that there's students who are part of our system-wide committee to provide feedback, guidance, advocacy, and support. And I know it's very similar in the CSU system as well, so that students are involved in, providing their thoughts and feedback, ensuring that there's representation of diverse student groups that are also at the table who can provide feedback and information about what's working and what's not working. I think from an implementation science perspective, one of the models that I like looking at it's called the EPIS model, EPIS. And as you're looking at exploring a new innovation that you're going to implement, you want to ensure that you're providing stakeholder input along the way. And then also, from a quality improvement perspective, check in with those stakeholders to double check whether or not the quote unquote intervention is successful, and including those metrics as you're designing and co-designing.
And I'll take a slightly different approach to this question, but one that really does get at the crux of the idea of involving students in any of our efforts. Jeannie mentioned earlier in our webinar this morning about the critical role of faculty and how particularly during the pandemic, faculty have perhaps had more contact with our students than perhaps anyone else, on the campus, college campus. It's critical that we not only educate our faculty on the availability of resources, but when we were talking earlier about the stepped care model of services, I can say, I think with a fair amount of confidence, that is not general knowledge, that the design behind that, the intentionality behind that, the importance of providing the appropriate level of engagement for a student behind that, as well as how it benefits students who are receiving those kinds of cares. It's important that we educate our faculty on that model. And one of the great ways to do that is to involve our students in speaking directly to the faculty. So that was a long way of getting around to, I think it's really important, whether we're doing a campaign, whether we're doing some kind of outreach effort, or we're doing education for our fellow colleagues, involving students in all aspects of that message is a very, very powerful tool. I can think of the numbers of the times over my years that I've walked into a faculty department meeting or into an academic senate meeting, or even into a committee or work group meetings that was primarily faculty populated. Having a student there with me to deliver a message was received in a different way than I myself as an administrator delivering that same message. So I think it's really important, and I don't mean using students. What I'm talking about is an authentic way of involving students and empowering students to speak about their needs, as well as how they have perhaps benefited from some of our care on our own campuses. I'm recognizing that we are truly almost at time, and I want to be respectful of other commitments that folks have today. Let me ask if there are any last comments from the panel. I do want to acknowledge that we do have a couple of questions in the Q&A feature that we will try to get to make sure that we are addressing your concerns. And Jeannie, I think you might have also had a last slide or two that you wanted to share. Do I have that right? No, you're good. Okay, let's go for last comments from the panel, 30 seconds to 60 seconds.
I'll jump in with one quickly that's related to a question that came in. And the question was basically, this fall, what do you think is going to happen with mental health? Is there going to be more utilization, whether it's in person or hybrid? And I think something we have to be very mindful of, which we've seen in the past decade, is if you build it, they will come. If you just bolster your counseling center, you're going to have a wealth of students demanding counseling center services. versus if you are very strategic and think about a much more broad-based continuum of care that involves self-help, psychoeducation, assessments, it's much more scalable. So we can reach more students and get students to the right level of support rather than overwhelming our counseling centers. So I think that's very important to consider, because it is likely that student distress is higher now more than ever. Would not be surprising if we saw a significant uptick in utilization this fall.
I think I'll just close in my closing thoughts to just thank everyone who has participated in this webinar. I think everyone in this pandemic has shifted to providing a different strategy or type of service. And I just want to commend everyone for all the work that you have put into serving our students across, any system or, higher ed campus that you're a part of, and just want to commend everybody for your efforts and work. And thank you for taking time out of your day to also, learn a little bit more to prepare for the fall.
Thank you.
I'll add to Jeannie and just be brief and say, we can't do this work without all of you. We just can't. And so thank you for coming. Thank you for having an interest in this, because that's what's going to help our students, is building a team.
Absolutely. And Jessica.
Yeah, just again, thank you so much for all the work that all of you do to serve our students. I'm really grateful for all that you do. And I guess just to encourage folks to use a targeted universalism approach, and thinking about, setting these broad universal goals to improve the well-being of all of our students, but really drilling down to create more targeted, unique processes and approaches for the unique needs of our students, given the varied backgrounds and experiences that they all have.
Yes, and finally, what I will say and join all of my colleagues in saying is, thank you for being with us, and more importantly, for all that you do on behalf of our students, on behalf of all of our students, and all that you will do as we shift yet again and move into uncertain territory of a fall where we know that we will have at least partial repopulation. Perhaps the pivoting out, if you will, of being in person will be in some ways even easier than the pivoting back in to the unknown of partial repopulation. And we appreciate all that you do in supporting students in navigating that pivot. In the chat, we will place the link to our CHEPNA Virtual Learning Series website. We do want to encourage you to share any and all of the recordings of our spring offerings with your colleagues. Please share this widely. If there was something in the webinar this morning that you would like to use as a prompt to begin or to further a conversation on your campus with your colleagues, please feel free to do so. And I think I speak for all of my colleagues on this call when I say we are more than happy to be a resource for you as you move forward. So please don't hesitate to reach out to us. We want to wish you well for the balance of what is the spring. Some of you are in commencement, some of you are in carmencement, some of you are getting ready to have a little bit, perhaps, of a few days of summer R&R. We want to really support and underscore the importance of that, and we want to wish you well through the summer as you begin to think about fall. Thank you so much, and take good care.
Thank you, everyone.